Thank you. Ms. Hardwick, I'm going to start by just finishing off some questions about the root cause analysis. Would you like a copy of it in front of you, or do you have it there?
A copy would be lovely, thank you.
What's my services? See if I can get that up for you. It sits behind your letter of the 31st of August 2022. That's all right. I might just ask Beck to put the page on there, and that might be easier, you can follow it. I'm going to put, for the benefit of my friends following, page 6 of the root cause analysis, and the court officer will have that up for you. In relation to the root cause analysis, you gave evidence earlier that you signed off on it effectively.
Yes.
You're reliant, aren't you, on the report writers in terms of giving you the factual basis for the report?
Yes.
And in terms of giving you their critical analysis based on the facts?
Yes.
At page 6 of the report, there are some conclusions expressed in the introduction. And paragraph 3 reads, after consultation with all staff members via teleconference, the consensus was that they were not feeling safe to stay within the community, and the decision was made to withdraw the health staff from Yuendamu. As a result of the reduction of services to Yuendamu, it was arranged that all emergency calls were to be triaged and attended by the neighbouring Yuendamu Community Health Centre. A police escort was available for these Yuendamu Health Centre staff if attending Yuendamu after hours. I just wanted to stop there. Are you now aware that in fact a police escort was not available for Yuendamu staff?
Yes.
That Sergeant Frost in fact expressed to Lorraine Walcott that would not be possible due to limitation of staff resources.
Yes, that's my understanding.
So it's disappointing, isn't it, to see that factual statement made when it's not correct?
Yes.
That introduction goes on to read, the above arrangement was made in consultation with the local police sergeant, that is the decision, the arrangement for the police escort, was made in consultation with the local police sergeant, community elders, other Yuendamu stakeholders and the on-call PHC management. When you read that, did you read that to mean that before the clinic staff were removed temporarily from the community, there was consultation with the police, community elders and other Yuendamu stakeholders?
It does infer that, yes.
And by firstly starting with the other Yuendamu stakeholders, who did you envisage had been spoken to prior to the decision to remove the clinic staff?
My understanding was that it was members of the Yuendamu community.
I see. Well, how does that change to, how does that differ from community elders?
I think the broader population across the community.
You didn't envisage that it involved speaking, for example, to the aged care facility or to Purple House or to the teaching staff or to other service providers?
Not necessarily, given that it was on a Saturday and many of those service providers are not open on a Saturday.
By consultation, I take it that you inferred that meant that there was discussion, dialogue, negotiation, debating, actually genuinely engaging in a discussion about the decision?
Yes.
Rather than just telling people on the way out that you were going?
Yes.
Do you now come to know that in fact there was no consultation with the police before clinic staff made the decision, or before management made the decision that clinic staff would be removed?
Yes, that's my understanding from witness statements.
And there was no consultation with the community elders or broader community before the staff moved out, do you agree?
That's correct.
Can I suggest to you that it is extremely disappointing to see that factual inaccuracy in a root cause analysis when you've got to sign off on it?
Yes.
Are you prepared to give that feedback to the authors of the root cause analysis?
Yes, absolutely.
It puts you in an embarrassing position, doesn't it? Can
Yes.
I suggest to sign off on it? At a management level, do you agree that there was a failure to ensure that there was appropriate consultation with those, with the police and the community?
Yes.
I anticipate, on the basis of all the information that we have heard this week, and including from yourself, Ms. Heinrich, to be submitting to Her Honour the following. Please tell me if there's anything that you disagree with. Firstly, that the attempted break-ins of the nurses' houses did create a risk to the staff.
Yes.
That every effort should have been made to manage that risk without resorting to leaving the community, if possible.
Yes.
That leaving the community was, may in some circumstances be necessary, but is a drastic conclusion to reach.
The decision was based on that assessment, and yes, it is a significant decision.
And given the significance of the decision, it needs to be the last resort in terms of managing risk. Do you agree?
Yes.
And I anticipate submitting to Her Honour that in circumstances where there was no consultation with the police and no consultation with community elders or other stakeholders, it was not clear that it was the last resort prior to the decision being made.
I think at the time the decision was made based on the information available by those staff on the ground and those management staff. In hindsight, we have learnt that the consultation was not as thorough as might have been.
In hindsight, you've learned that the consultation was wholly inadequate.
Correct.
The staff moved out. Do you agree?
Correct.
Police told clinic staff that they were responding with more staff, more police into the community, and that should have been factored into the risk assessment. I think you've already conceded.
Yes, yes.
And the failure of a written risk assessment in terms of, or I'll draw that, I'll just go to the point you've been taken to previously, is that there are, at page 15, it notes that there are two primary and competing concerns in relation to a risk assessment. One is the safety of health workers and the other is the safety of the community.
Yes.
And I don't diminish for a moment that the importance of the safety of health workers.
Absolutely.
But you would say, wouldn't you, that the safety of the community is at least equally important in balancing concerns?
Absolutely. It's a combination of both risk assessments.
And in these circumstances where there is no written evidence of any risk assessment in relation to the safety of the community, it's not possible to conclude that there was a risk assessment done.
That's fair, yes.
And the importance of formalising a risk assessment on the day was to ensure that nothing was missed, in part. Do you agree? No opportunity was missed?
Yes. And I think in relation to the risk assessment, as we discussed earlier, while it was not documented, I have a full understanding that the staff involved, because of their experience, will have undertaken that risk assessment. The gap is the documentation.
Well, I just want to test that for a moment. We know now that Nurse Cassandra Holland her evidence is that she was happy to stay, that Nurse John Alting was happy to go to Yullamoo to provide backup services for the community, so that if you'd had an emergency in both communities at the same time, that would have been of enormous assistance with Mr Alting. Do you agree?
Yes.
And given that those two nurses at least were content to stay, one in either community, that should have been factored into the risk assessment, shouldn't it?
Yes, it's not clear when that information came to light in terms of the decision.
Doesn't that underscore the importance of making a written record about what everybody thinks?
Yes, absolutely.
Do you think that fatigue might have played a role in the failure to properly record the decision making?
Quite likely. Fatigue plus external workload. We understand that the manager on call will have taken multiple other calls in terms of primary healthcare activity and the like, in addition to the Yuendamu incident.
Do you mean by that Helen Gill?
Yes.
So in terms of the responsibility to formalise the risk assessment on both sides, to the nurses and to the community, did that lie with Helen Gill?
With Helen Gill and her senior executive team at the time.
Has Helen Gill and her senior executive team been provided with feedback in relation to the paucity of documentation about the risk assessment?
Certainly we've had that discussion, yes, in terms of risk assessment, and our review post that, and I referred to the changes, I guess, since COVID, where we are required to assess risk routinely, consistently, in a changing profile, and we have indeed reviewed those documentation processes.
One failing I'm going to suggest to you in relation to the consultation prior to moving out was a failure to adequately consult with the Aboriginal staff to see whether or not there was anything they could suggest before
Yes.
getting into the position with clinic staff and moved out. Do you agree with that?
Yes, absolutely.
Moving to a different topic, in 2018, my review of media resources suggested there were some criticisms of the Yuendamu Clinic at the time. Were you familiar with an article published by the ABC to that effect?
No, I'm not familiar with that.
Do you know after whether or not there was a review of the clinic services that followed on from some criticism of the clinic in 2017 and 2018?
No, I'm not aware of that.
In order to find that out, who are we best placed to ask?
I would work through the General Manager, Primary Healthcare.
And who is that at the...
That's David Reeve at the time, at the current time.
Within that article, there is a suggestion that community members were not being adequately transported to the clinic in order to access services. That's something that we can ask the current clinic manager, but has that ever been brought to your attention?
I'm actually aware that from recent, we call them consumer surveys undertaken in the Yuendamu Clinic, that was one of the more recent pieces of feedback as well, and I've seen a flyer indicating that the staff are working to improve that transport to the clinic. So yes.
Is there a service providing transport to the clinic?
No, I imagine it would be through the clinic staff themselves, perhaps the Aboriginal health worker who would assist in that process. As well as, there is a gardener driver role that is recruited into the clinic that may assist with those functions as well.
That's a position currently open, is that right?
Yes.
Is the clinic accredited, as far as you're aware?
Yes, it sits under the AgPAL accreditation, and all of the Central Australia remote community clinics are accredited under AgPAL.
Can you explain what that acronym stands for?
I'm sorry, I can't right now. I certainly will. Helen Gill will certainly be able to help with that tomorrow.
Thank you. And am I best placed to ask Helen Gill about the process of accreditation? And
yes.
what that involves?
Yes.
Have you been aware of any complaints being made about allegations of bias towards or racism towards members of the community, either unconscious bias or unconscious racism or actual complaints of racism?
I've not received any complaints, no.
Would they come to you?
We have a process, so certainly complaints would likely go through, again, depending on where the complaints are coming from, potentially through the clinic manager, maybe to the district manager, maybe to another leadership role within primary health, such as the director of nursing, and potentially then through to the general manager primary health care. Where there is a significant incident of investigation, it may well be that is raised with me as the delegate for various processes.
No doubt that's something that we can ask Ms Gill when she gives evidence tomorrow, but if there was, for example, or if there was a level of engagement between staff and community where the community could give the staff feedback about things that they were not, about certain behaviours that they were concerned about, you'd welcome hearing that, wouldn't you?
Of course.
Have you heard any complaint about Aboriginal people being made to stand outside the clinic rather than being allowed indoors?
I've not heard that complaint, no.
During COVID, there was obviously a need for changes in some of the protocols so that people would not risk infecting others. Are you aware of any kind of standardised protocols or procedures that were introduced across clinics?
We established a large number of protocols across remote clinics and in the hospital itself. They were in line with largely national standards around managing or preventing the spread of COVID.
Did they involve one patient being in the clinic at a time?
I couldn't confirm the detail, but likely it was all about a restricted impact towards each other. So again, looking at those concepts of social distancing to minimise exposure to other people, the wearing of PPE, protective equipment and the like. So it may well have involved a reduction of access to the clinic at any one point in time.
Are those social distancing protocols still in place in remote clinics?
There is a component whereby, yes, we support across our health clinics, again, social distancing as they should be in all places.
Do you agree that that needs to be balanced, as particularly given where we are now in October 2022?
Yes, absolutely.
Pandemic, it needs to be balanced with behaving in a way which is culturally appropriate.
Yes, absolutely.
And so you would welcome any feedback from the community, wouldn't you, as to whether or not the community feels that staff are getting that balance right?
Oh yes, of course.
Are there performance indicators in place so that somebody in your position can assess the performance of the Yuendamu clinic as opposed to other regional clinics, remote clinics?
Yes, we have a suite of key performance indicators that are identified under the service delivery plan. That service delivery plan is set out by the system manager. In my situation, that's the Chief Executive of NT Health, in terms of the performance of the communities. At a high level, that looks at the communities collectively, so it's not necessarily that each of the communities has stepped out. That responsibility would sit, unless there was an issue, of course, that responsibility would sit with the branch or the division of primary healthcare to investigate those particular matters, which is why we work to a district model to ensure that there is good opportunity to look at the performance within those particular clinics.
So is that an issue that I should take up with Ms Gill tomorrow in terms of the functioning of the Yuendamu clinic?
She may be able to provide a response. In terms of those safety and quality indicators, yes. Alternatively, of course, the General Manager for Primary Healthcare may provide information.
Who is David Rees, is that right? So I'm thinking, just to make sure that I am structuring my questions adequately to the right people. For example, we heard from Dr Rosser, I think, about the high rates of rheumatic heart disease in Yuendamu. And we certainly heard that from a nurse yesterday. In terms of the rates of compliance with regular echo screening for patients with rheumatic heart disease, are statistics kept about comparisons of Yuendamu to other communities?
I can't comment specifically. That is not one of the KPIs in the service delivery plan currently.
Do you think it should be?
I would assume that there are data kept on that, but it's not part of the service delivery plan. There is a suite of designated KPIs that belong within that service delivery plan.
What about the rates of attendance at outpatient clinics for patients from Yuendamu compared to other communities?
At outpatient clinics in Yuendamu or in Alice Springs?
Well, let me start with Alice Springs then.
Certainly we monitor attendance rates of people in the Alice Springs outpatient department and, for example, to other appointments such as elective surgery. By and large, that is not by community, it is by the individual and working to meet the needs of that individual.
What about rates of chronic disease screening?
Yes, again, the rates that I would look at are the rolled up rates for Central Australia, not necessarily by clinic. That would sit with the district manager and teams within those areas.
But those figures are certainly kept as a KPI so that you can look across the communities?
Yes.
And similarly, rates of staff turnover?
Yes, we collect some of that turnover data, yes.
Would you be concerned to know the reasons for example, if you had a much higher rate of staff turnover in Yuendamu than Tennant Creek, you would interrogate that?
Yes, yes.
Because there might be reasons for that which include anything from poor performance of the clinic to Tennant Creek being an easier place to live.
Yes, yes.
And there might be lessons to be learned across that spectrum for somewhere like Yuendamu, is that right?
Yes, yes.
Who's responsible then for reviewing that?
I think it's a broad team in the primary healthcare branch. We have a number of people who look at that. As an example, the recruitment of nursing and the turnover of nursing might fall within the portfolio of the Director of Nursing for Primary Healthcare.
So well, let me just ask you then in relation to Yuendamu, are you currently aware of whether Yuendamu has a higher rate of staff turnover than clinics like Tennant Creek?
Not specifically, no.
But those figures are kept. Someone
Yes.
will be aware of it.
Yes.
Likely David Reeves.
Yes.
Is there a general physician who visits Yuendamu?
Dr. Rosser? Oh, sorry,
A general
GP.
physician, so a consultant.
Yes, we have. I can't say who that is, but certainly we have a cycle of rotation of general physicians into community. As I referred to earlier, we try to ensure that the general physician, again, has repeat visits into that community to ensure, again, some continuity and development of relationships, but I can't tell you who that general physician is.
Does attendance by the general physician depend on the number of referrals that are made by the clinic staff?
There is a cycle of scheduling, so there's a scheduling program of general physicians. Equally, there is an opportunity for the general practitioner to make contact with that general physician, so there is equally opportunity to do that.
It must be an important way to skill up your GPs as well, to give them some access to specialists?
It's certainly important, like for any GP, to have access to specialist services, yes.
So do you know whether or not statistics are kept on the rate of referrals by GPs in Yuendamu to specialist physicians as compared to referrals in other communities?
I imagine, yes, we could gather that data.
Again, David Reed is the
Yeah,
right person to talk
yeah.
about.
And we're very happy to take these questions offline to
I'm
provide.
grateful. Thank you very much. Overall, how do you tell then if clinically, and I ask this not to be critical, but to work out whether or not there are ways to support remote area clinics, how do you tell if one clinic is underperforming clinically as compared to another clinic and therefore needs greater support?
Again, this is perhaps not directly within my portfolio, but I would imagine that, again, the governance structure of primary healthcare with the relevant managers would be able to identify that very readily, much like we would in a hospital with the relevant managers identifying gaps in service delivery. That may be through things like the KPIs that you've referred to. It may be through consumer or customer feedback. There may be a number of avenues of feedback to assess that. That is the role of the manager, to understand what is working in that community and what is not and what needs to be addressed. That's the role of a manager. As I mentioned, we have a district manager who has oversight of a number of communities, and equally with reporting lines for clinical expertise through to a director of nursing or indeed a medical practitioner.
It sounds like that's something that I can take up with David Reeve or Helen Gill, is that right?
Yes.
On a related but slightly different topic, I was referring to and discussing with you in the break a book called Illness is a Weapon, which is a book written about the Warlpiri people in Larjamanu. One of the points taken from that book, and I anticipate some of it may be in evidence shortly, it talks about the importance of having male staff members so that health staff can work within Warlpiri cultural norms, where there are expectations that male clinic staff will work with male members of the community. Are there specific efforts made by NT Health to attract sufficient numbers of both male and female staff members so that we can work within those cultural expectations?
I would have to say that recruitment is, of course, our key. Recruitment of all disciplines, gender and the like is a key. In terms of the management of ensuring appropriate gender for cultural needs, certainly that is taken into account in terms of allocation. So how a person may be allocated care on the day, by whom would be the most appropriate. That would include in relation to the Walpri and Yuendamu, utilising men's visiting services, so the men's assessment service as well, to support some of that aspect.
If I'm going to put a scenario to you, if you heard from Walpri elders and emerging leaders that in fact there were some cultural norms that were not Walpri norms that were not being respected by the clinic because, for example, there were not sufficient male staff, you'd be really interested to hear that, wouldn't you?
Yes, absolutely.
And one creative way of working around that might be to see if there's a male physician available, then you have them attend more regularly to Yuendamu to make sure that Walpri culture can be better respected.
Yes, absolutely, using visiting services differently.
So that underscores, doesn't it, the great need to hear from Walpri people about what their expectations are of service delivery.
Absolutely.
And you're saying, and I'm particularly thinking about anybody who's listening to the live stream now or later, or listening to our Walpri summary, which goes up at the end of the week, you welcome feedback from the community about that?
Yes, absolutely.
And you welcome participation by Walpri members of the community, or by all members of the community, about how this health service can be provided in a way that is more culturally respectful.
Yes.
If there are shortfalls.
Yes, absolutely.
I want to ask you some questions about Purple House. We understand that Purple House is the Tanami Regional Dialysis Unit, or includes that service?
It includes that, yes.
And that service, according to their website, began operating in 2010 and enables Walpri people from Yuendamu and nearby communities in Yuelamu, Wallara and Nirapi to receive dialysis on country.
In Yuendamu, yes.
And the delivery of that service is overseen by the Tanami Regional Dialysis Committee.
I can't comment on that, sorry.
In Yuendamu, are you aware that they now run the non-residential aged care program?
I am aware, but not deeply associated with that, yes.
You don't attend the local advisory board, am I right?
That's correct.
Can you remind us who does from NT Health?
Yes, amongst the health staff located in Yuendamu, David Reeve, General Manager, Primary Healthcare, attends.
Do you know whether or not Purple House also attend that local advisory board?
I can't confirm that, I'm not sure.
That's a matter for, I can add that to my list for Mr. Reeve. In relation to the meeting that you do attend, the stakeholder meeting, am I right that you do attend the stakeholder?
No, I don't attend the stakeholder meeting.
Are you aware then you've spoken about the stakeholder meeting? Do you know whether Purple House attend the stakeholder meeting?
No, I'm not aware.
Are you... David Reeve attends the stakeholder meeting, is that right?
Certainly members of the health service would attend the stakeholder meeting. I think that's the one chaired by the Department of Chief Ministers. Yes.
We can, and Mr. Hampton is on our list of witnesses, so we can ask him about that. But you would certainly expect them to attend the stakeholder meeting, or is that right?
Purple House?
Yes.
Or I don't have oversight of that stakeholder meeting, I'm sorry.
Let me ask you a different question then. From your position within NT Health, it's important to have good relationships with the staff from Purple House providing that dialysis service to you.
Yes, absolutely.
Do you know what the relationship is like currently between the Yuendamu Clinic staff and Purple House?
I can't specifically say what that relationship is, but certainly the clients who are attending the dialysis clinic in Yuendamu, run by Purple House, would be receiving dialysis care from Purple House, but maybe receiving chronic disease care and emergency care through the NT Health Service Clinic. So certainly there is an overlap in terms of that care service, and so communication between the teams is important, yes.
You're not aware currently whether that communication is whether there's room for improvement in that communication?
No, I'm not aware.
I assume, given your position, you would welcome some feedback in that regard if there is a way to, if there is a shortfall in the communication.
Yes.
Are you aware of whether or not they have the same issues of retaining or of attracting or retaining staff that NT Health have?
Again, I don't have the detail in terms of recruitment and retention for Purple House or Western Desert. I do know that they have had some challenges, for example, recently needing to temporarily close a renal dialysis service due to staffing challenges. Those patients were relocated to Alice Springs to the NT Health services.
Which was that community?
Utopia.
They haven't closed services in Yuendamu though, is that right?
I'm not aware that they've closed services in Yuendamu, no.
We heard from the nursing staff this week that in terms of their socialising just with each other and not with other stakeholders, they did not, for example, socialise with the staff at Purple House. I suggest to you that it was a missed opportunity when the clinic staff moved out in 2019 to at least speak to Purple House to see whether those nurses might be available to provide any emergency care.
Again, in terms of emergency care, I'm not aware of the skill set of the dialysis nurses. They are qualified to provide dialysis and may not have emergency skills of a remote area nurse, remembering that a remote area nurse undergoes particular training and qualifications to provide that emergency response.
Sure, but isn't the point that the staff there didn't know, and neither did management, what were the skills of the Purple House nurses at the time?
Nor indeed the number of nurses present in community at that particular point in time.
And it would have been worth finding out.
Possibly, yes.
Does it surprise you that nurses living in the same community, a small community of less than 1,000 people, don't communicate with each other before such a significant decision is made?
I think it depends on the circumstance at that particular point in time. The nurses were communicating with each other in relation to their particular concerns around safety.
I anticipate submitting to Her Honour that there needs to be an urgent look at whether or not relationships between all the stakeholders can be improved so that you have better communication in relation to any sort of crisis. Do you agree with that?
Yes, certainly. There's as we've talked through those opportunities to share information, either in a meeting circumstance where there is opportunity to do that. And from my perspective, the introduction of the role of Carl Hampton in community is definitely around that better communication coordination in community. So one would assume that will continue to improve with his presence and role in coordination.
Do you think from the perspective of NT Health that if you're going to have an orientation for staff members when they come into the community, it might be useful to have an orientation on a monthly basis for all staff from all different stakeholders that's provided by elders and emerging leaders?
That could be an idea.
It's a way of getting stakeholders together on a regular basis?
Yeah, possibly.
And getting them engaged with community members, including elders?
Yeah, possibly.
Well, imagine you're in the position of a nurse going out to a community for the first time. I'm going to suggest to you that it would be a positive thing to be able to meet with other service providers on a monthly basis in a less formal setting where you're working with Walpri leaders and elders to learn culture.
Yes.
And similarly, language classes. Can you see the value in staff in the clinic learning Walpri or learning as much Walpri as they can?
Yes, and I think some of our witnesses have referred to the fact that they have learnt some language.
Might one way of getting stakeholders together be to have language classes together?
It could well be, yes.
In relation to the issue of the gap in service delivery, which you're trying to fill to meet unmet needs, a significant need is counselling, and specifically trauma counselling. You agree with that?
Yes.
Yuendamu in particular, I'm going to suggest to you, has a history which means that many people have been impacted severely by trauma. Do you agree with that?
Yes.
Are you familiar with the Coniston massacre that occurred in 1928?
Yes, I am.
And I suggest to you that the impact of colonisation generally creates enormous trauma that needs to be addressed.
Yes.
And there were riots in 2010 that led to 100 people leaving the community. That's likely to have created significant trauma
Yes.
across all age groups.
Yes.
That young people in 2010, many of the young people in 2010 are teenagers now who might have ongoing behavioural issues related to trauma.
Yes.
And so although all communities might call out for counsellors, Yuendamu has a particular need. Do you agree?
Yes.
And we've heard that there is a need to provide male and female counsellors. Do you agree with that?
We need to have a gender balance, yes.
And in addition to the counselling services, a psychologist should be provided.
So under the Social Emotional Wellbeing Program funded by Commonwealth through the NTPHN, there is a psychologist position funded. I think the witnesses have referred to those people who have filled those positions previously. We have noted that that position is currently vacant despite recruitment efforts, and we are certainly hoping that we can recruit into that position in the early new year. We also have, as I mentioned earlier, the AOD aftercare worker, who, again, we have historically been able to support a gender balance between those two positions.
I'm going to suggest to you that it's not enough to just have that one funded psychologist position or the AOD, that there needs to be counsellors in the community, male and female, to help address the unmet need in relation to trauma. Do you agree with that?
I think everybody has a role, and I think it's looking at what those positions are. Again, nursing staff have a role in counselling, medical staff have a role in counselling. We have the social emotional wellbeing program with the psychologist, we have the AOD social worker, and we have visiting services that support that. But indeed, we can look at additional positions to support that.
We heard from nursing staff yesterday that they thought there was a very significant need for counsellors based in the school, male and female, to support young people between the ages of 5 and 15 because they are not seeing them in the clinic to provide any services.
That's something that I have not had addressed directly with me. Interestingly, given that we've got our regional coordination group in Yuendamu today, with the executive lead of education, that may indeed be something that's addressed today in Yuendamu.
Given it came from one of your nurses yesterday, and in fact we've heard similar evidence from more than one witness, are you prepared to take that up in terms of the unmet need?
Yes, I would need to talk to education to understand what the resources are in schools.
But that's certainly an issue that should be addressed at the stakeholder meeting. Do you agree?
Again, I'm not a member of the stakeholder meeting, but yes, it should be a point of discussion.
Do you know currently whether there are any counselling services provided by WIDAC?
I can't comment specifically. I understand there has been work with through the Commonwealth to provide funding to WIDAC, but I can't confirm where that discussion is at.
Would you have an expectation that David Reeve, for example, would know about that because he's attending the stakeholder meeting?
Yes, he may be aware of that more closely.
In terms of particularly given the recruitment challenges in a community, it's just vital, isn't it, for stakeholders who are capable of providing some of the similar overlap services like counselling to be able to know what each other's capacity is. Do you agree?
Yes, which is certainly, again, something that's being worked through, for example, from a visit today through regional coords.
And do you agree that stakeholders need to support each other to the extent possible?
Absolutely.
I'm going to ask you about attracting staff firstly. You make a point in terms of Yuendamu, it's a community that's hot and dry and there are some challenges. It's not by the beach, for example. But can I suggest to you that in terms of recruiting, people need to understand that working in Yuendamu is an amazing opportunity to work with Warlpiri people?
We've done our best through a recent recruitment campaign to do exactly that, to offer through people being filmed about their experience, to talk about what drew you to a remote area, not necessarily specifically Yuendamu, but into remote communities. So we've certainly used that to understand what is it that draw people into communities, because people are drawn, and that definitely has been the theme of the campaign, to understand what is it that draws you into a community, and how might we attract others based on what we've learnt from staff.
Where was that campaign rolled out?
July 2022. That's the local Central Australia campaign that I refer to in my affidavit. There is further campaign to be expected to be rolled out in early 2023 through the NT Health program. What we've done in that campaign, though, is definitely to draw on the experiences of people in community, equally people working across other parts of our service, to tell their story, to share their story, so that we don't market palm trees and beaches, that we're marketing what is real to Central Australia.
In terms of what is real to Central Australia and the opportunities provided, is it part of that campaign to get the message out that one of the great strengths of working as a nurse in a place like Yuendumu is that you get to be autonomous to a larger extent than you would in a city?
Yes.
That it's nurse-led care for much of the time in community?
Yes.
That you get to engage with a community?
Yes.
And that you get an opportunity to engage in a broader practice
yes.
than you would do in the city.
Yes.
So working in Yuendumu is an opportunity that can foster your career.
Yes, and certainly there's some of the taglines we've used in our recruitment campaigns.
Has it so far borne fruit that you can see, the July campaign?
I think it's early days, to be honest. And again, no one strategy is going to resolve recruitment. We certainly have had some strong feedback. In fact, only this week that a magazine, and I'm sorry, I don't know which magazine, has made contact literally based on one of our remote area nurse YouTube videos, that they are very interested in the nurse who spoke on the video and keen to provide a magazine article. So for me, it's about how do we get that message out there. Having loaded a number of these recruitment videos on YouTube and starting to market that, it's a multi-pronged approach to ensure that that message about those opportunities is relayed. Equally as important is that retention, so that we are supporting staff when they arrive, both through onboarding and ongoing professional development and the like.
No doubt you are interested to reflect on what staff have said in this inquest as to what are the strengths and challenges for them working in Yuendumu.
Oh yes, absolutely.
One of the consistent themes, might I suggest to you, is housing.
Yes.
That the colour bond fencing, which was well intentioned, has not had a positive impact on the staff, at least that gave evidence, for a number of reasons. One is that it doesn't make them feel safer, because in fact people can get over the yard without them seeing. And secondly, that in fact has the effect of cutting them off from each other in terms of socialising.
Yes.
And thirdly, that some staff felt it cut them off from the community and made them feel more. Is that something that NT Health is now prepared to look at in terms of perhaps reusing that or removing that colour bond fencing, at least as it's currently positioned?
NT Health does not have management over the private or the leased houses. That's a communication through to NT Housing, and certainly that communication can be had, yes.
I anticipate getting some more feedback from stakeholders as to what it would assist in terms of making life more comfortable in Yuendumu and making life, and also helping them to integrate with a community that they care about. Can I suggest to you some low-hanging fruit and see if you agree with me?
Yeah, sure.
One idea that's been proposed is the pool opening for longer hours, so that and perhaps a gym being provided so that people feel that they can maintain their mental and physical health.
Yes.
Another is a social hub or cafe potentially attached to the pool and gym, so that people feel that they've got somewhere to congregate.
Yes.
And you're aware, aren't you, that the pool is something that's really popular with the community?
Yes.
And so that actually making everybody feel comfortable there is a good way to get people together.
Yes.
If we could, well, I would draw that. Have you recently engaged in any survey work with staff to see what would assist them in terms of making them, helping them stay longer in community?
Yes, I mentioned earlier that we have undertaken a remote area nurse survey that was led by our nursing office. I believe that was in the last 2-year period to understand the preferences of staff, yes.
And have any of those preferences been acted on?
There are a number of preferences that are being considered. One of the examples is access to fresh foods and the like. We are looking at campaigns around how we can support that differently, perhaps through a click and collect program, and again looking at how we engage people through our wellness programs. So those activities are being assessed. Equally, we know that professional development is very important for staff.
Have you looked at, in terms of staff getting some respite from community, as opposed to a model where they come out of community for 4 weeks, a model where you can come into Alice Springs, into accommodation on a more regular basis, say once a month, once every 6 weeks?
Yes, my understanding is that that occurs.
Is the accommodation then funded when staff get some time out?
It's available through NT Health, yes.
Do you know how often staff have that option?
I'm not 100% sure, but certainly we're looking at our accommodation guidelines at the moment. That is a broader aspect of our recruitment and retention program. We are currently looking at the completion of a new accommodation build in CBD Alice Springs, and thinking equally about how we might utilise some of that new build for staff who are looking to retreat from remote areas, in addition to attracting staff into urban Alice Springs. So a combination of the use of that service. We're changing some of those protocols in terms of accommodation management. We have a large accommodation portfolio given the vast FTE within our portfolio, and we're looking to centralise the management of that accommodation portfolio so that we have a greater oversight and a better utilisation of those services.
Final topic, Ms. Heinrich, is the idea that's been raised with you previously about socialising with other stakeholders. I appreciate your evidence is that people have different personalities and some might be more social than others. But do you agree with the principle that stakeholders can be an important support for each other?
Oh, absolutely.
And that it's important to break down any barriers that currently exist so that those staff who want to take up opportunities to get to know each other can do?
Yes.
And that there might be a need for stakeholders like NT Health to be proactive about that, particularly after COVID.
Yes.
Are you aware of any survey that's been done of current service providers in Yuendamu outside of NT Health or inclusive of NT Health as to what might help them to develop better relationships?
I'm not aware of any such survey.
Would you welcome that being done?
Yes, of course.
Thank you.
Mr. Hutton, did you have anything else?
No, thank you.
Thank you very much for providing your time and your detailed affidavit and all the documentation attached to that. We appreciate the effort that you've gone to provide detailed information to this inquest.
Thank you, Your Honour.
Sorry, Your Honour, just one last matter. While we reflect on these important matters, can I just observe from the family's perspective that with Ms Fernandez-Brown in court, that today would have been Kumanjayi Walker's 22nd birthday. Thank you, Your Honour.
Yes. We'll adjourn till tomorrow at 9:30.
So, I know we closed it.